So we're going to begin. Hi, everyone. Thank you for joining us today, and welcome to this online rally and press conference on COVID-19 in the public sector. My name is Emma. I'm a member of Free Transit Ottawa, and I'll be moderating today. Although we are gathering online, it is still important to recognize that most of us, anyway, are engaging in this rally on the traditional unceded territories of the Algonquin Nation. We are here today because Free Transit Ottawa developed a statement on transit policy calling on the city to introduce a series of measures to better protect transit users and providers. It has been endorsed by about 15 groups ranging from union locals to environmental and social justice groups. Given the current context, we wondered what the best way to publicize it would be, so we decided to hold an online rally and press conference and invite a few others involved in defending and improving public services to join us. Since it has become prevalent in our communities, COVID-19 has challenged two key aspects of what we're supposed to believe is common sense. One aspect concerns the government. Here, the common sense view is it is the private sector that provides the good life. Government, especially public services, really aren't that important, and what we spend on them should be reduced as much as possible. As for the workers who deliver those services, well, at best, there are too many of them, and at worst, they are overpaid, lazy, and are viewed as scoring that cushy government job. The other piece of common sense that has been challenged concerns the economy. It has been an article of faith that creating a world where corporations are free to organize their businesses however and wherever they see fit is in everyone's interests. Of course, some of us have never believed these things were true, but today, as a result of COVID-related changes, there are a lot more of us with this way of thinking. In the coming weeks and months, we're going to be trying to draw some lessons from this experience to figure out what changes we feel are needed and how we can make them happen. We see today as an early, modest step in that direction. So tonight, we have 4 speakers who I will introduce shortly, who have been asked to speak to the impact of COVID in their own area and what they want to see happen post-COVID-19 and after restrictions are lifted. This will be followed by a question and answer session. We will be taking questions through the chat box, which can be found at the bottom of your screen. I will send a quick little message. So you should see the notification pop up at the bottom. Okay. So you can submit your questions as you think of them or at the end. When the speakers are finished, I will read out 3 questions at a time and we'll try to keep a balance of the genders when selecting the questions. If there's anyone who is unable to ask questions using the chat box, I will open up the floor at the end for anybody who needs to use audio instead. But the preference is that if you can please use the chat box. And I'll also ask that you all keep your audio muted just to reduce any distracting background noises. I'll be keeping an eye on the chat box as well, so if anyone has any questions or is having any technical issues, I can try to address them. Okay, so tonight we will be hearing from the following people. First up is Chelsea Fluke, who is with Free Transit Ottawa. She has her bachelor's in political science from the University of Ottawa and lived there from 2003 to 2008 and returned to Ottawa in 2019, where she now works in communications at a nonprofit. Next up will be Clint Crabtree, who is the president of ATU Local 279. Clint is from Ottawa and joined OC Transpo in 2011 following his father's footsteps. Third, we have Aisha Bassett, who moved to Ottawa last summer. She's the mother of a preschooler in daycare and a founding member of the local branch of childcare now. And then finally, it'll be Michael Hurley. Michael grew up in Ottawa. He became a hospital worker in 1977, was a key figure in the illegal strike of hospital workers in 1981, and has been the president of the Ontario Council of Hospital Unions since 1990. Okay, Chelsea, you can take it away.
Sure, and thank you so much, Emma, for the introduction and for convening this panel tonight. So just a bit about Free Transit Ottawa. It's a group made up of environmental and social justice activists who share a common goal for a more equitable and sustainable future for all. We see public transit as having a really crucial role in combating climate change and promoting social justice in Ottawa in particular. So transit in the pandemic. We know that transit's been declared as essential, and that we're grateful and glad for that. But we think that the city could go a bit further in a couple ways, which I'll elaborate in a second. So, I mean, we know that the people who are continuing to use transit are folks who are going to essential workplaces, or they're folks who are needing to make trips because they don't have alternative transit options for getting their groceries or getting to the pharmacy or to various appointments and things. So we need to consider this first point. And also that we want to keep in mind that the safety of the users and operators is really key right now in this context. So we're talking about basically transit being accessible and made safer. How do we do that? Well, we're calling for 5 things right now. We're calling for the city and the mayor to suspend fare collection, formally declare it as such. This is really important considering that a lot of transit riders right now might be experiencing a loss of income. Some might have no income at all, and yet they still need to use transit for these essential trips. Keeping in mind as well that 16 cities across Canada have implemented free transit, but OC Transpo has only announced backdoor boarding and that drivers won't accept cash payments. So Presto cards are still expected to be used, and the gates, the fare gates on the LRT remain in operation. This in particular is presenting some challenges for seniors who are expected to make additional trips to Shoppers Drug Mart or Loblaws to get their access to their discount card. And there's a lot of unresolved questions about the accessibility of the Equipass right now. Currently on OC Transpo's site, it's not clear how people are supposed to access them. So one of our concerns is that for certain folks, perhaps this has represented an increase in the cost of their fare. But additionally, we think that all riders right now, regardless of any of these considerations, should have access to free transit because, they shouldn't be made to feel guilty if they can't pay, or that they shouldn't be worried about fair transit operator, fines and enforcement and things like that. So that's a main key point for us. We also are calling on the city to maintain a level of service that allows for physical distancing. So there was a switch to a reduction in service, but this is a bit risky because then that means that sometimes there's more people on each bus, and that this might put in jeopardy the safety of the operations. So in particular, we'd like to see service increase during peak hours during the pandemic. Likewise, the city should make masks and hand sanitizer available on all buses and trains. I think that this goes without needing a whole lot of qualification there. And in particular, we want the city to protect transit operators. So this might mean, easy access for COVID testing for everyone who's operating OC Transpo and Paratranspo. And we also want to see that the transit operators have regular access to washroom breaks for washing their hands, particularly before they eat, things like this. So I think that these would go a long way in improving our transit right now in the pandemic context. But we also need to keep in mind that, as we start to think about transitioning out of a pandemic, what do we want to see? So in preparation for a post-COVID recovery, Free Transit Ottawa came together a while back to articulate some demands around how to improve transit before all of this struck. And so it's important to know that some of the context has changed, and we're very much interested in hearing feedback from folks tonight as well about their ideas for what could be improved. But this is some of the key ideas that we were developing prior to all of this hitting. So, I mean, considering the fact that we have to find ways of bringing people back to transit, we have to make it safer, we have to make it affordable. Considering that a lot of people are coming out of the pandemic and they might be financially squeezed, we would like to continue to see, accessible transit for financial reasons. And that it'll be about making people have confidence in the system itself around safety, around accessibility. So our initial vision, there's a document that you can find on our website on freetransitottawa.ca, and it's called a new vision, and it calls for several changes, to which I'll just outline a couple here, but it's to make transit more affordable and increase service, to create bus-only lanes during rush hour so that the routes that are habitually late actually have a chance of getting to places on time. And another key thing is to democratize the Transit Commission. So we want to see citizen representation on the Transit Commission itself for decision-making power. And that these would be essential for going a long way in improving transit in our city in the post-COVID recovery context. You know, as we think about the recovery strategy from COVID, we also need to keep in mind that there is a climate emergency that is ongoing. And so investing in public transit makes sense right now. And we need to be pressuring the city, but also the province and the federal government to think about transit as a post-COVID economic stimulation strategy, as a good way of getting us towards our climate goals and overall making things more affordable and safe and fair for everyone in our city. So I'm going to leave it at that. I understand we're doing questions later, so thank you.
Okay, next up is Clint.
Good evening, everyone, and thank you for having me. Thank you, Emma. So I just wanted to talk a little bit about the impact on my membership at ATU Local 279. I'm the president at ATU Local 279. And also the impact on the public that my members serve. We have about 2,700 members at my local. We represent OC Transpo, Paratranspo, and we represent Alstom, and we represent the Royal Canadian Mint. But as far as the transit industry is concerned, this has been a massive impact on my members and the anxiety that they're dealing with every day of going to work and dealing with the public. Their morals, that they had a reduction in service, backdoor boarding. We were the first ones in North America to get that backdoor boarding implemented through our local and OC Transpo. Then the backdoor boarding happened, and then you're seeing more people on buses because there's been a reduction of service. So you have a smaller area on the bus now, and you have a reduction in service where you're not allowing social distancing. So it's had a massive impact on my members as far as they want to pick up the passengers, they don't want to leave anybody behind, but yet they're looking at a bus, and you're looking at a 40-foot bus, and then you're seeing a lot of people on a 40-foot bus. There's no social distancing, you've reduced service, and it's just morally wrong. And I think the city should have looked at that before they had the reduction in service. And that is one of the things that I brought forward to them. As soon as you reduce the service, you're having and taking a chance of having the buses overcrowded. And that has happened. So I think they had to do a better job on maintaining safety for the public and as well as my members. We've done a lot of good things. We provided masks for all my members. I think it would go a long way, like Chelsea said, to provide masks, sanitizer, everything else for the public that takes these buses as well. I think that would be a great idea. The impact on this, and this is something that I touched on before COVID-19 came in, was the cleanliness of the buses. So currently at OC Transpo, what was going on in the last few years, there was talk of a staff downgrade. That never came to fruition. They needed those people, and they're still short those people to maintain the cleanliness of the buses. We need more workers at OC Transpo to maintain the cleanliness of the buses. This is something that I talked about before COVID even came. I was in the media talking about this. Cleanliness of the buses isn't happening, and then all of a sudden we got hit with COVID-19. I've had some members get ill, contract the virus, caught the virus, and that's the anxiety that they're faced with every day. And they've come to work, they're still coming to work. We are deemed essential, but yet we're not getting essential pay, and everyone else is. And that's something also that my membership has brought forward to myself and my executive board, that they're deemed essential, but they're not being treated as an essential worker, which I think is wrong. Something I'd like to see come out of this and COVID-19 going forward, obviously, for my members and the public, is the cleanliness of the buses. I think it's paramount. And what has gone on today just proves that these buses need to be cleaned. They need to be kept clean, and not just the floors swept. They need interior cleans. They need full interior cleans. And that will require the city of Ottawa to hire more people. It will. There's no doubt about it, but it needs to be done. And there's also another thing that we brought up, and this was a safety issue at one time, and this had to do with assaults. But I think going forward, I think shields and barriers would be a good idea to install on all the fleet. First, it was about assaults, but now I think it's about everything, viruses included. So I think that's something that I'd like to see in the future, and I'd like to see the city of Ottawa do that for the members. But you know what? They're going to keep coming to work. They're going to keep doing what they can for the public. And that's what we're here to do, is we're here to serve the public. We're here to give them a good service. We're here to give them good accessible transit. That's what we need to see. These are the things that I agree with, and I want to see that as well. So going forward, there has to be changes at the City of Ottawa level for transit, and they need to be done. So I'm going to end on that, and thank you, Emma.
Okay, next up is Aisha from Childcare Now Ottawa.
Hi, my name is Aisha Bassett, and I'm a parent of a preschooler and a member of Childcare Now Ottawa. We're the new Ottawa chapter for Childcare Now, and we're here to fight for universal childcare in this city based on decent and dignified work for childcare workers. To all the parents in Ottawa who are having a hard time coping with the impossible childcare demands of this crisis, and to all the early childhood educators and other childcare workers who are terrified they won't have the job that they love to go back to, we hear you, and we want to come together with you to fight for a just recovery. So I'm here to say essentially three main things. First, the city needs to take action to save the childcare sector, which includes making public and specific demands to the province and also to the federal government. Second, we can't roll back the clock on access to high quality licensed childcare in Ottawa when we go into recovery from this crisis. Instead, we need to reverse decades of austerity and build a real safety net that includes high quality, universal childcare as a pillar. And third, childcare workers themselves need to help define what a return to work would look like for childcare workers and the kids they care for, not just be rushed back into potentially unsafe situations like what we're seeing right now in Quebec. Just this morning, I read a news story that daycare outside of Laval has 16 people infected. That includes workers and children. What we're also seeing is that we're still gathering data from all of Ottawa's childcare providers, but we're already seeing childcare centers at risk of laying off staff, or centers that are unsure if they're going to be able to cover their costs like rent or mortgage. We're in a situation now where childcare programs might close outright or have a very hard time reopening. That means that parents in Ottawa will see even less quality licensed childcare available to them than they did even before this pandemic hit. And we know that the wait lists were very long even before the pandemic. What we need right now, we need full stabilization funding right now for all of Ottawa's childcare programs. Other provinces and jurisdictions have already taken note of this obvious problem and have taken steps to shore up their childcare sector and guarantee the residents will have access to programs to send their kids back to once things do reopen. National Childcare Now and the Ontario Coalition for Better Childcare have pointed out over and over that all levels of government have to play a role in making sure we have daycares and early learning programs to go back to when the worst of this crisis is over and when people in Ottawa are able to get back to work. The delays in announcing a rescue package for this critical and essential service that is childcare is actually disappointing and feels like an attack on working mothers in particular who have fought for decades for access to universal childcare, which is something that other countries and provinces and cities do value very deeply. It's worth remembering that Ottawa was already in a rough shape in terms of access to childcare before the coronavirus. According to the city's own numbers, only 1 in 3 children in Ottawa actually have access to licensed care. And even when it is available, licensed childcare is completely unaffordable for most parents in Ottawa, where most parents are paying well over $1,000, if not $2,000 a month for childcare, while rents go up and life gets more unaffordable across the board. On top of that, this completely unaffordable system is built on the backs of low-wage childcare workers, the majority of whom are women who badly want to stay in the profession that they love, but instead have an incredibly high turnover rate because the deplorable compensation paid to them. The system was fragile and completely inadequate even before the crisis hit. High parent fees were the main funding source for this whole system. And now we will see that parents, women in particular, that are already struggling with balancing work and childcare because of the pandemic, have to scramble to get decent childcare for their kids, or they have to stay at home. I want people to compare this to elementary schools. Parents don't have to worry about their kids having a school to go back to when we're ready to do that safely. It's a universal service that everyone has a right to. We might rightfully worry about class sizes or resources or other details of the system, but we don't worry whether our kids will have a school to go to. And why should childcare be any different? We want parents, childcare workers, and everyone else interested in a fair recovery from this crisis to join us in saying we need childcare for all right now. We need a people's bailout, and the city of Ottawa has a role to play in this. The politicians of our city should be fighting for childcare right now, out in public, making it obvious that they see how essential it is for everyone, in particular for women. And before I go, I wanted to make it clear, frontline childcare workers need to set the terms of this recovery, but also they need to set the terms of emergency childcare right now. We only have capacity in Ottawa for 36 kids at emergency childcare centers, and these only cover children up to 5 years old, meaning a lot of healthcare workers, grocery store workers, frontline workers are scrambling to find ad hoc childcare for their kids right now. We need to expand emergency childcare right now, but childcare workers need to have a seat at that table. Lastly, as a parent, and as parents and childcare workers, we at Childcare Now Ottawa won't accept being forced into a rushed reopening. We'll fight to make sure our kids and the tireless, hardworking people caring for them have PPE and anything else that they need, and have a seat at the table with Ottawa Public Health, the city, and the province to make sure they're not being asked to sacrifice their health or put kids at risk. Thank you.
Thank you, Aisha. And finally, we have Michael from the Ontario Council of Hospital Unions.
Thanks very much. This is a great forum. Excuse me. Well, we should all be worried about what's going to happen after the crisis, because we were in austerity programs, pre-COVID, and governments have been spending enormous amounts of money, much of it directed obviously towards subsidizing large corporations, by the way, right? So, has there been a political shift in thinking in the country? I'm not sure there has, in which case we're looking at another period of retrenchment and attacks on public services like transit and childcare and so I think that's something we need to talk about. Children and older people are not valued in this society. They're not productive, and so they don't have value. And it's a national shame that there isn't a national childcare system that's universal and not for profit, and that transit is not free, and that people are living in long-term care facilities where they're dying by the hundreds, subject to all kinds of neglect during this current crisis. Denied access to hospitalization by virtue of age, and cared for by a skeleton staff, the lowest levels of staffing anywhere in the country. So, I mean, in terms of healthcare, there are about 500,000 people who work in healthcare in Ontario, and they do that with the fewest resources of any country with a developed economy. And during the COVID crisis, they have currently a casualty rate of about 16.4%. To put that in perspective, in China, total as a percentage of total cases, it's 3.8%, and in Holland it's 6%. In Italy it's 10%. Only Spain has more healthcare workers sick at 20%, and we're going to eclipse them within another 10 days in Ontario. And that's because we don't value healthcare workers, primarily female, largely racialized, and we've watered down safety protocols. We don't provide them with the protective equipment, which is recommended for the kind of virus we're dealing with. We don't acknowledge that it could be airborne when, there's lots of science that makes us concerned that it is in fact airborne. There's no meaningful consultation going on that I can see with unions or the workers who are working on the front line, which makes me worried about the future, because I'm not sure that the thinking has changed very much. I'm not sure that we're coming out of this with sort of some kind of democratic, inclusive, more generous approach. I think we're at risk of teetering into more authoritarianism and much more social control and much more restrictive financing for social programs, unless we're much more active than we are. And to do that, we're going to have to talk about some of the weaknesses in our organizing capacity now, which maybe we can explore during the crisis. But you should take great credit for the work that you're doing, because even putting demands like free transit on the table is an enormous thing to do. And that is exactly, of course, what should be happening. Free transit, free childcare, free healthcare, right? Free university tuition, etc. I mean, and we should talk about some nationalization as well, but maybe in the questions.
Great, thank you. Thank you to all of our speakers. So we're going to now open the floor to questions. So if you could all type them into the chat box. We have about half an hour for questions, and just a reminder to the speakers to please keep your answers to about a minute long. Okay, so the first one comes from Kirsten. How likely is it that we will see any expanded spending on public services in coming months with the stimulus package as expected? This is for everybody. I was originally going to ask 3 questions at a time, but I think they're going to be a little bit slower to come in. So if you wanted to answer this first question right away, first person can go ahead. I'll just repeat the question. How likely is it that we will see any expanded spending on public services in coming months with the stimulus package that is expected?
Well, I mean, wouldn't we be right to be worried about that in the sense that, I mean, the Ontario government wasn't only concerned about deficit budgeting, it was concerned that it had hit a debt wall. And I'm not sure the federal government's approach to budget deficits was very much different. So now they've spent hundreds of billions of dollars more. And has there been a fundamental change in their thinking? I'm not convinced there has been. Oops.
To try to answer the question, I think it'll be up to sort of a people's movement to call for a people's bailout. That governments, and I think we'll see a lot of the sort of business interests lining up to say, all right, that was all fine and dandy, but now is the time for additional cuts and additional slashing of budgets. We need to recoup that. There's some troubling indications at the federal level with respect to some of the news around the infrastructure bank and some of the key movers and shakers over there in the direction that that's going to go. With regards to ongoing privatization or public-private builds, as we've seen and had a lot of fun with here in Ottawa. But I think though that that there is a window of opportunity to point out that a lot of what we're seeing right now is the failure of public service cuts for over 30 or 40 years. And that the privatization and contracting out and the cuts that have come and the sort of slashing of services has made us very vulnerable to being more susceptible to problems relating to the pandemic. And so I think that in some ways the pandemic is a full condemnation of, we can't go back to austerity times. We can't go back to prioritizing, budget deficits and all that. I think that there's some interesting conversations around whether tax evaders should benefit from the government programs. I think that we need to push in some strategic directions about who will pay for this crisis. And there's plenty of people right now in Canada that are doing very well. The Loblaws chain is raking it in. Are they passing that on to the workers? No. Amazon is doing fine. So I think it'll be about exerting and organizing enough political pressure to make these demands for childcare, for free transit, for expanded, possibly nationalizing or making long-term care public, and bringing that in fully under the public domain. But I think that we definitely need to counter that and have a people's movement to move that forward. I don't think that that'll just happen.
I agree with what Chelsea said, and just want to add that we think we need to push for a sector-specific bailout package, one that recognizes childcare as upholding many other sectors. And I would refer to the National Childcare Now's federal proposal, which almost all childcare advocates in the country are pushing for right now, for a sector-specific rescue plan. Just seeing childcare is not just a small business, it's a fundamental service that enables parents, particularly women, to go back into the workforce.
Okay, so the next question is, what does the panel think of the New York City's move to close 60 kilometers of roads? That's from Donald. There's a second question as well from Donald. So he says he can understand transit workers wanting shields, especially since the arrival of COVID-19, but is there a danger that this will make the buses less safe for transit users, especially women? Is there another way to address the driver's safety concerns?
Well, I don't understand how that would be or make it more unsafe for women. Currently, an operator of a bus driver, is not to engage in anything that is going on with passengers on the bus at the moment. So I don't know how that would make anything unsafer for having a bus operator behind a shield for anybody. I think what it does is make the public safer, because when we are faced with operators getting assaulted, and if they were assaulted while the bus is in motion with a full bus, I think that would be a catastrophe, and you need the operator to be safe on that bus. And that's why our local was pushing the shields and barriers for all the buses before this pandemic arrived. But now, since this has arrived, this makes the shields and barriers, in my opinion, all that more reasonable.
I think that on the road closures, I mean, in the new vision document that's available on our site, we do call for priority bus lanes for some of the routes that get snarled in traffic. And I think that like right now is a really good opportunity for the city to rethink how we are using our roads. How do we share public space? Should we continue to be a car city? Should we, really take this time to push for massive uptake in public transit when we're heading out more towards a recovery time period? But I think that these are interesting questions that, since a lot of things have been put on pause, that we don't have the kind of gridlock that we normally see, we can start thinking about those things. And I'd be interested to hear also what other participants on this call think about that as well.
Okay, the next question is from Manfred. Do we know the current estimates of the budgetary impact of the COVID crisis on the city's finances? I think we need to have a good idea of this in order to forestall the threat of future austerity as indicated by previous speakers. Certainly, public pressure will be critical, hence the importance of this meeting.
Well, when you imagine the revenue losses for the city, for transit, for parking, all sorts of revenue from businesses, loss of businesses, and when you stack that on top of all of the economic damage, I mean, a recession is coming. I think that's, I don't mean to be gloomy, but I think a recession is coming, and that will have an impact as well on employment, on revenue. Businesses I think are gonna struggle a bit. So, to have an approach where we talk about the need to infuse levels of government and services with support is a dramatic change from the current political orientation, right? Which is to starve childcare, for example, right? It's not to, so, and that is what should happen. These services should be infused, absolutely. And how do we create the dynamic for that to happen despite the recession and despite some significant losses in city tax revenue, and also then when they go to seek aid from the province or federal government, those levels of government are also dealing with the auto sector is hurting, the airline industry is hurting, and so on, right? Small business is in pain, and there's all this competition for for resources. So, I mean, we will have to be very well organized, which is not by any means impossible, but we'll have to be better organized than we've been recently to be effective, I would think, but we can be, absolutely.
I would just add that, yeah, we haven't seen any specific estimates about the budget shortfalls at the city, but it will likely be massive, as we could all imagine. At the same time, we expect the city to loudly be pushing for a package from the province, given the legislated limits the city has on its spending power. And we know for a fact that the city has been reluctant to make appropriate demands on developers to pay their fair share. So there's a lot of room there as well. Just to add a bit to that. Thanks.
You get a sense of where the right is coming from in the United States, where they're more open about it, right? I mean, they're, the Republicans are saying, let these jurisdictions go bankrupt. They're not talking about bailing them, right? They're talking about letting them bankrupt themselves because they see it as a way to downsize. Like the struggle continues, right? It's, and they're warriors.
But also, I mean, there's an argument to be said about, childcare and as well for transit, where when you invest in it, that there's an economic return there. That building the sort of infrastructure that we need to meet some of our climate emission targets in particular, that's investment in jobs, as Clint was saying from ATU, currently right now to have more people available to clean the buses. Well, that's more employment. Sure, that's more debt, but that's still more people being able to keep a roof over their head and keep paying their taxes. So I mean, there's an element of, yes, it's spending, but it's also still stimulus, and to no longer accept that cuts are without consequences to people in communities who work these jobs.
Okay. So Kirsten would like to know each of your opinions on whether we should be focusing on reopening to ensure funding goes into public services or wait longer to protect workers from frontline hazards.
I have strong opinions about reopening, so I'll just go first. I have a public health background, and I've been following this very closely from lots of different angles. And every second morning I wake up and I do my morning research on where things are at. We're not at a point of reopening. And one of the main reasons why we're not at a point of reopening is the lack of testing. So when I hear City of Ottawa has 1,000 or 1,200 cases, I understand that given the barriers to testing that we currently have in place, that it's not actually 1,200, that number is 3 times that which is being counted. So we are very far from reopening because we actually don't even know the full extent to the spread of the virus. And from what I can tell, there is the way that epidemiologists and evidence-based policymakers do work is one way, and the way that Doug Ford's government does work is a very different way. And I could see the tensions when they arise, and there are very clear differences between what the research says needs to be done and what the Ford government has done, which has not always been what the research says. So I would be very reluctant to even have a conversation about reopening. That being said, we've been in our apartment for 2 months with a small child. So I love to talk about reopening, which is probably what motivates me to look at the research every other morning. Thanks.
for transit, more or less what we're talking about is protecting workers from frontline hazards and users, so transit users and transit providers. That needs to be done right now in the interim as we're still in this, and that for a reopening, that any measures we put into place now, such as masks and hand sanitizer, that should be on a go forward basis. So yes, we'd love to see expanded accessible transit in a post-COVID context, but right now it's very much about improving things from a safety perspective for all, and from an accessibility point of view as well, that people are feeling the pinch. They shouldn't have to worry about whether they are evading fares, or I couldn't get my Presto card loaded, or I don't even have a Presto card. Because people right now just need to get to point A to point B as easy as possible. And of course, with not too many people on the bus, that would jeopardize social distancing. So that's basically our position.
So yeah, like Aisha said, I'm reluctant about reopening as well. I think that as far as I'm concerned at OC Transpo, they should put back the regular service. I think that would help a lot. And that would help the public in being safe on the buses. So I think OC Transpo can do that, where they put back full service. But as far as reopening everything else, I think, you know what, we have to see where this goes. And I think it's too early yet. But having said that, I don't know how long society can survive the way we are today. So I am very reluctant about reopening everything.
Now, I would agree that it's too soon and that our testing is woefully inadequate when you compare us to South Korea, Taiwan, or Germany, where we're like so backward in that respect, and we have this big focus on not overwhelming hospitals, but but I'm quite concerned about what will happen when we open up too soon, and that's going to have consequences for sure.
I think any reopening needs to be done in a democratic way and needs to bring together workers and other people who are directly affected or more affected by a reopening, to bring those people to the table to have their stakes addressed. We are seeing this currently, as I mentioned, about this daycare that opened in just north of Montreal, where they had previously given the false, very misinformed information that the children are somehow not vectors, and now we have 16 staff and children at a daycare who are infected. So I think that any kind of reopening needs to take into consideration the reality of where we're at and the reality of the virus, but also we are not equally affected by a reopening. Someone like myself can work from home. My childcare providers cannot do that. They're differently impacted than I am. So they should have more to say, more ability to say something about reopening. That's it. Thanks.
So we have just over 10 minutes left. So if anybody would like to ask a question using the audio because they don't have access to or aren't able to use the chat box, you could go ahead and unmute yourself and ask the question now.
I have a question.
Okay, go ahead.
I came in late. Maybe this was addressed at the beginning, but I wanted all the speakers to talk about how supporters of workers' rights in Ottawa locally can support the struggles that are going to be happening in all these workplaces that deliver such important services.
Well, I think things are going to come to a head. I know they are in the healthcare sector because the workforce, is to some extent, cannon fodder. Reminds me of the Russian army in 1916, where every third soldier had a rifle, and they sent them over the top in waves. Like, there's no respect really fundamentally for the workforce. We lost a member at Madonna Nursing Home. He died yesterday. That didn't have the equipment that locals filed grievances about access to the kind of protective equipment you'd need to keep yourself safe from this virus. They don't have that equipment. The government has watered down the safety protocols. I do see in New York City, 20 bus drivers have died, right? I'm sure you're more familiar with that than me, but, out of this, I think might come, and I certainly hope it does, a profound reflection about value and gender and work and class, and how we're going to respond to the fact that we're treated in the way that we are, and what we're going to do about it, which in the case of long-term care means nationalization of the industry, and means talking about the staffing levels and the remuneration for the people who work in this industry and all the rest of it. And the childcare, right? Like the wages are, they're terrible, right? And there's no pensions, and so like, there are opportunities in this crisis. I think we need to think about if people can focus on them and get people engaged in a positive way. And that's certainly my hope.
Yeah, like ATU across North America, we've had 40 of our members die from COVID-19 right now. So just in the province of Ontario, we've had a couple work refusals done under health and safety, which went absolutely nowhere. So workers' rights right now are not being met. I think as far as the Canada Labour Code and under the Canada Labour Code for federal employees, and this imminent danger to do a health and safety work refusal has to be readjusted, because imminent danger and having a work refusal done under that is just, to me, unacceptable. I think there could be better wording. I think there could be, and I'm not trying to say leniency, but I mean, you know what, when you're not providing your employees, workers with the proper protective equipment to perform their job, well, I think, your rights are not being met. So I think we need to do better going forward and after post-COVID-19.
Can I pick up on one of the earlier questions? I think Michael touched on it, and someone else as well. Can we see the unions leading this struggle? Bringing workers together across the kind of divisions that exist. I mean, reaching out to more of the unorganized sectors of the workforce. And collaborating in some new way that might help us develop the strength to ward off the threatened austerity.
I'll answer that. I think, yeah, definitely that is a possibility. I think you got to get everybody on board, and all unions got to get back on board and start doing things together instead of fighting one another. And I've noticed that in this country over the last couple of years. I've been involved in the union with ATU, and prior to that I was with Teamsters. I mean, I find that unions are fighting each other these days, and we got to get away from that and join together and do this together. So I think it can be done. It's going to take some work, and we got to do it.
Folks who want to find a way of getting involved, we have 2 online actions right now for Free Transit Ottawa. If you go to our website, there's one relating to improvements around transit for COVID, And then there's the broader new vision, which again, I've kind of said that was developed before COVID. So if there's ideas or suggestions, we want people to get involved in our group. And that basically that the coalitions matter and that we can't expect, you know, the folks only at ATU to fight this fight, that there's a bit of a, I think, a dismissiveness that the union comes forward and the government says, yeah, whatever. And then this is reported in, you know, the news that the union wants something and everybody kind of shrugs. But I think people's coalitions are really important because it's supporting those voices of people who are on the front lines, but also talking about it from a user's point of view. You know, that not having our drivers get sick is good for the users, and having our buses cleaned and having more people hired to do that is good for everybody. And so in that sense, we can't expect the people who are already fighting austerity and fighting all these things for however long to be the only ones to do that as we emerge out of this situation.
I could go next in terms of what Childcare Now Ottawa could use in terms of support. We can definitely use all the help. We need organizers first and foremost. I'm going to send our email in the chat just now. It's ottawa@ccnow.ca. And there is also an online petition that is going around right now. If you go on Facebook, you look up Childcare Now Ottawa, you could find links to our activities as well as the petition. And our Twitter handle is Ottawa CCN or @OttawaCCN. And I guess you could contact me directly on the chat as well if you have more questions. Thanks.
The unions are a little lost, right? They've been a little lost for a long time. You know, I mean, I think we should admit that, no? You know, they're not actually socially engaged. They are competitive. They act like competing organizations, and that's not healthy. And they don't work well together, and they haven't been working in coalition in a meaningful way. And you know, in some sectors, absolutely. But you know, like out of this, does there come a period of reflection by childcare workers and grocery clerks and transit operators and long-term care workers about, well, if I'm essential, why am I treated the way I am? Why am I paid the way I am? Why don't I have the right to refuse? 243 work refusals in Ontario, not one upheld by the Ministry of Labor and Healthcare. Like, come on, like really? Not one was valid. Don't buy that at all. So, like, wouldn't that be great if there was a reconsideration by working people about their place in the world, and I think that is what will ultimately drive some profound changes in the union movement, which is what it really needs. It needs to be reoriented in the struggle of working people, and a struggle for national programs like universal childcare and free transit. It needs to be rooted in taking back the long-term care industry from the for-profit sector, et cetera, right? It needs to have goals and ambitions that are meaningful, and it needs to put people on the march. So I think all that's doable. And I do think people are beginning to reflect on this. I hope they are.
Okay, so we are coming up on 7 o'clock, and I just wanted to thank all of the speakers today. So thank you, Chelsea, Clint, Aisha, and Michael for sharing your perspectives and insights. I'm looking forward to see how all of these industries can work together to improve working conditions and user conditions after COVID-19. And thank you to everybody who asked questions and engaged in the discussion. Okay. And just a reminder, if anybody would like to read our statement online, the website is freetransitottawa.ca. Thank you, everybody.